Good morning, everyone. I was able to finally found an article that's written by Jessica Staniland back in December 2019, comparing ADHD mixed with complex PTSD. And that's very important for me, so I'm going to introduce this to you guys today. So, have your child or adult been exposed to potentially significant trauma at home at some point in their lives? Has your child been diagnosed with attention deficit disorder, ADHD, but there seems to be a piece of a puzzle missing? Some of the questions like this, which is in more descriptions, it's questions to consider when determining whether your child may be experiencing a trauma reaction, which may be either the underlying or accentuating their ADHD. So we all know what ADHD is. I'm not going to introduce that. The main symptom includes impulsivity, hyperactivity, distractibility, poor concentration, racing thoughts, and motor reactivity. But what's interesting is that these symptoms could also be seen in a chronic hyper-arousal after trauma. So it is related to ADHD, and it makes the emotional dysregulation or emotional regulation even harder for ADHD people that suffers complex PTSD like I have. So what is complex trauma? It's called C-PTSD. It refers to the exposure of multiple traumatic events that are severe and pervasive, such as exposure to a natural disaster, exposure to domestic violence, childhood abuse, physical, sexual, emotional, neglecting their children's basic needs. They all happen to me. What makes recognizing complex trauma challenging is that it's subjective, and child's traumatic stress response depend on the temperament of the child, development age, severity and duration of the trauma, protective factors such as supporting family, consistent schooling environment. Now, what's interesting also is that siblings exposed to a serious traumatic event can have very different reactions. It really depends on the people. So, why is there so much overlap? What may appear as inattention and daydreaming, which I made a video about that, we don't daydream. We always think. Behavior always seen in ADHD may actually be symptoms of disassociation or subconscious avoidance of trauma triggers. That's something new I learned today. Intrusive thoughts, memories, and other reminders of trauma may make the person feel confused, agitated, and nervous, which may mimic impulsivity and aggression often seen in ADHD. So, could my child or the adult have complex trauma and ADHD? Absolutely. If there has been complex, significant trauma exposure, complex trauma is often a misdiagnosed because the parents often underreport trauma of their kid, just like what I did. My mom said I walked into a wall after I got beat up. Clinicians don't always ask questions about possible childhood trauma. Well, force your clinician to do it, or else change your clinician, because you need to tell your physicians everything. Complex trauma is simply misdiagnosed as ADHD due to significant overlap between the presentation, and there is under the description a picture that you guys can see. So, if your child may expose to significant trauma, seeking from a professional help as soon as possible. Your health professional is there to support you and your child, and you need to tell them everything that you know, and do not underreport. Trust your instincts. If you feel like your child's diagnosis of ADHD is not quite right, make sure you raise your concerns with your physician. Remember, children and adults with ADHD with C-PTSD background needs consistency, predictability, and routine with their lives, both at home and at school. You need to help to develop lasting, safe, and predictable relationships. That's awesome. Please support people whom they feel comfortable going to, who understands them and can empathize with them. A sense of control through being provided limited choices. And lastly, to learn to build on their strength and resiliency. Treatment options for ADHD, we already talked about. Now, we talk about trauma now. So the treatment for trauma, therapy with psychologists who may utilize trauma-focused cognitive behavior therapy, TF-CBT, and sensory regulation activities mixed with anti-oral, anti-anxiety medications that might be a possibility. So I hope you guys learned something today. This is the first article I've ever seen that relates ADHD to trauma. So please watch the video, pass it on. Thank you very much. Have a wonderful day.